Okay, so so first question, let's start with the first question. When do coronary arteries primarily receive the blood flow? So remember the answer over here in this question is option. Yes, please. Anyone can tell me the answer in the comment box? Can you tell me the answer in the comment box, please? Okay, so answer over here. Remember, they are asking about coronary arteries primarily receive the blood flow. So we know that there are coronary arteries, right? Uh, so coronary arteries. So what we say about the coronary blood flow? There is some things which are very specific regarding the coronary blood flow, right? Okay, answer I'm getting from Anmasti, Mansi, right? So, what is the answer over here? Yes, please. The answer in this question is during the diastole. Answer over here is option B. Answer over here is option B. Now, why this happens? Remember, in the coronary blood flow, there are muscles, right? In the heart, there are muscles which are like crisscross manner, which are present in the crisscross manner like that. Okay, and then you do have vessels in between the you can say muscles, right? So there are crisscross muscles. So whenever the contraction of the heart occurs, that means the muscle contract, right, like that. So from here, they are going to contract. What is going to happen to the uh, blood vessels that are present in between? They are going to squeeze out, right? They are going to squeeze the blood vessels, right? So that's why this blood vessels are going to get squeezed, right? So that's why during the systole, the coronary blood vessels, they are going to squeeze. In between what? In between the muscles. In between the muscles. And that's why what is going to happen is that whenever the muscles contract like this, right, the next thing will be like this. During the systole, the muscles is going to contract, and that's why this blood vessels almost obliterate, and that's why what is going to happen, there will be no blood flow or very minimal, no or very minimum amount of blood flow. Very minimum amount of blood flow will be there in during what thing? During the systole. Then whenever diastole occur, what do you mean by diastole? What do you mean by diastole? Diastole means relaxation of the heart muscles, right? So whenever the heart muscles are going to relax, what do you think what should happen over here? So these muscles are begin to relax, right? So these black things are the muscle fibers. If they start to relax, what will happen? Yes, please. If they start to relax, the blood flow, the blood vessels, what is going to happen to the blood vessels? Blood vessels, they are, yes, please, what they are going to do? The blood vessels, they are going to dilate. They are going to dilate. not there. Yeah. अनुज जी प्लीज आके देख लीजिए अनुज जी प्लीज ये क्या लाइसेंस मांग रहा है बार बार क्लास चल रही है और it is totally unrelated to the inspiration and expiration, right? So blood flow, it is totally unrelated to the respiration, because during the inspiration also and during the expiration also, what is going to happen? The heart rate will be going on, right? Which is not related to this. So that's why the answer of this question over here becomes option B. It is option B. It is purely option B, right? Okay. Now you can hear me, Nikhil, Aisha, Pratya. I think you are able to hear me now. Are you able to hear me now? Okay. So the first question. Okay. Thank you, Mansi, for giving me the reply. Okay. Fine. So I guess there is some lag during the video and during the chat. Okay. So anyway, let's moving on. When do you have the coronary arteries to receive the blood flow? That means they're talking about the, yes, please. What thing? They are talking about the blood flow during the diastole. So remember, the blood is going to flow during only and only during the diastole. So that is the case about the heart. So this is the exception. Why they're asking you what happens is the rest of the tissues. So whatever tissues are there, so rest of the tissues, they are going to receive the blood flow during the systole as well as diastole, right? If they ask you about any other tissue other than the heart, what should be your answer? The answer should be, the best answer should be both. Remember, rest of the tissues, maximum amount of blood flow, if they ask, then definitely that is going to happen during the systole. But remember, if the option is there of both, then go with the both, right? So then go with the both. So remember, the both is the most appropriate answer. But if they ask you about the rest of the tissue and the option both is not given, then go with the systole. Then go with the systole, except the heart. When you talk about the heart, then heart receives the blood flow during the diastole, and the rest of the tissue receives the blood flow during the systole maximum and the diastole. So both. Okay. I hope you understood this phenomena of how this is going to work. Okay. So let's move on to the next question, that is, a murmur is heard at second. The murmur is heard at the second left intercostal space along the left sternal border. Okay, so what they are talking about? Second left intercostal space. Okay, so let's see the diagram. So this is the diagram that I wanted to show you for the first, you can say the first question. So you can see over here that in the systole, what is going to happen? The blood flow is decreasing, but in the diastole, it is going to increase. It is increasing during the diastole, rather it is maximum during the diastole. So this can be given to you as a pictorial or diagrammatic question. So you must be knowing that this is talking about the heart. Why? Because during the systole, heart is the only one organ in which during the systole there will be minimum blood flow, right? So that's why what you're going to talk about whenever you they give you such diagrams, then you must be knowing about, yes, this is talking about coronary blood flow, right? Okay, so look at this diagram. Now look at this diagram. What you can see in this diagram, there are 4 different points which are shown over here, right? So what are the 4 different points? One is over here, one is over here, right? These are 4 points. So what these 4 points are denoting, actually, these 4 points are denoting nothing but your areas of different levels or areas of different valves. Okay, so remember, in our heart we do have 4 different types of valves. Valves are nothing like a door, right? So we do have 4 different doors, right? So as we can see that we do have 4 different doors, right? So what are those 4 different doors? Let's talk about that. So remember, there are 4 different doors, or you can say these doors are nothing but your valves from which the blood is going to enter inside the different areas of the blood of the heart, right? So suppose if I draw a very primary, you can see, diagram of the heart. So you are going to have one door over here, right? One door over here and another 2 doors over here. So remember, there are another question also which is coming towards us, the next question which is related to this. So concentrate, I want your 100% concentration over here. So one door is to enter the blood from the, this is, suppose this is left ventricle, this is left atrium, this is right atrium, that is right ventricle and left ventricle. Very, very basic diagram, right? So one valve will be there which will allow the blood from left atrium to left ventricle, right? There will be another opening which will be giving rise to the, yes please, what structure is this? Yes guys, what structure is this? Please let me know what structure is this. Okay, and there will be another structure which will be going behind this like that, which will be splitting up into two. The blue structure is what and the red structure is what? Yes please, comment down below. So what is these structures? Okay, there will be four openings, right? Yes please, mitral valve. Okay, Nikhil, mitral valve. Okay, right. So this is, which we're talking about, this valve is mitral valve. Very correct. The one valve over here will be present for the blood to go from the left ventricle towards the body. That valve will be for aorta, right? So that is nothing but your aortic valve, right? And this is over here from the, there will be valve which will be going from the left right ventricle into the lungs. Okay, so there will be presence of this blue color vein, you can say, right? So that will be for your pulmonary artery. Okay, this is the known as artery, remember, but this is carrying your deoxygenated blood, right? So pulmonary artery, right? Functionally it is vein, but it is known as pulmonary artery since it is going away from the heart. It is going away from the heart, right? And there is a opening which will allow the blood to go from, yes please, right atrium to right ventricle. So that will be called as, yes please, which valve is this? This is your tricuspid valve. Now, these are the four valves, right? Two valves which are present, which will allow the blood. So basically we do have, yes please, two valves which will allow the blood to go from atria to ventricles, right? Two valves which will allow the entry of blood from ventricles to either lungs or other tissues, right? So the valves which are going from the atria to ventricle, these will be called as, since it is going from the atria to ventricle, these will be called as atrioventricular valve. Atrioventricular valve. And these valves which are allowing the blood to go from the ventricles to the tissue, these are known as, yes please, these are known as semilunar valves. These are known as semilunar valves. Okay, so these are the four valves which we do have. Two atrioventricular valve, and yes please, two of them will be your semilunar valves. So the colorful ones are the semilunar valves and the black ones are the atrioventricular valve. Atrioventricular valve. Okay, fine. Let's come back to our question. What they are asking us is their area. So the area is given, that is left intercostal space. Okay, and that to which one? The second left intercostal space. So let's have a look on this diagram. So this diagram, what it is showing? This diagram is showing various areas. So there are four white dots which are shown, right? So you have to see that which area it is shown by. So remember, the first area over here in the fifth intercostal space, which is given, that is for mitral valve. Mitral valve. If you keep your chest piece of the stethoscope. Stethoscope have various parts. So if you keep your stethoscope on this area over here, then what you're going to see is that you are going to hear a voice, and that voice will be closure of the mitral valve. Okay. Then beside that, at the lower end, what you're going to hear is another voice, that is during the closure of tricuspid valve. So this is known as tricuspid valve area. Okay. And another area, I'll make you write everything, give your 100% attention over here. So another area which you can see on the upper part, that is the area over here that is shown. So I hope it can write. So over here, if you see that this area over here, the second intercostal space, okay, left to the sternum, that is your pulmonary or pulmonic area, and right to the sternum, we do have aortic area, right? So these are the areas which are shown over here, and that's how actually they look like. So if I have to discuss these 4 areas, what they will be look like, or what they will be seen like, right? So give me a minute so that I'll show you. Okay. So remember, there are 4 areas that we talked about just now, 4 areas, right? So yes, please, the mitral area, that is area for the mitral valve, which is going to be shown as the 5th intercostal space, right? So this is present at 5th intercostal space, at where on the left side, where in the mid clavicular line, remember. In the mid clavicular line. The importance, a very, very important, very much important over here thing is that this is also known as, yes, anybody can give me a reply of this. This area is also known as, yes, please, till that point, till the point when I get the reply, I'll move on to forward, right? Then there will be an area which will be known as tricuspid area, which will be again you can see over here, where is that tricuspid area? Over here, 5th intercostal space, but near, or you can say the left border of this sternum, right? So left border of the sternum. So the tricuspid area present on the, again, 5th intercostal space, but where? On the left side again, but where? In the left border of the sternum. Left border of the sternum. Okay. Left border of the sternum. Then let's move on to the another area, which is the area for aortic valve. Yes, please. Yes, I got the answer from Akhil, right? So this area will be called as apex beat, the area for the apex beat. The area of the apex beat. Why? Because the apex of the heart is present at that area. But remember, what you are hearing it, that is the sound reflecting from the mitral valve. That is the sound reflected from the mitral valve, right? And that is why it is known as the mitral area, but the apex beat of the heart is also present over there. So that's why it is known as the apical area of the heart, or apex beat is present, so known as apical area of the heart. Apical area of the heart, right? Okay. Then aortic area, where it is present? Aortic area, it is present on the 2nd intercostal space, where? Towards the right side, remember, towards the right hand side, in the, where? Parasternal line. Parasternal means near to the sternum. Near to the sternum. This is the only one which is present on the right side, which is present on the right side, right? Then we have a pulmonary area, which is present in the second intercostal space again, but this is present on the left side. This is present on the left side. Okay, again parasternal. So their pathway is such, and that's why we do have what these four areas present at four different levels of the our intercostal space. Okay, so that's the diagram for it, which is showing the actual how the areas look like. Okay, fine. So I guess that's all for this question. So can you tell me the answer of this question? Second left they are asking, and we just now saw the second intercostal, which is present on the left side. That is nothing but your pulmonary area. So answer of this question is your pulmonary area, right? So that question leads to us towards the answer. That is answer is C. Answer is. Move on to the next question. Which one of the following landmark is correct one for obtaining an apical pulse? That you are going to tell me the answer. That what can be the answer of this? Just now we discussed what is the answer of this. Yes, guys, please give me the answer in the comment box. Please give me the answer in the comment box. This question I'm leaving over here because I want the answers from you guys. We just now discussed, right? Let's move on to the next question. Third, I'll come back and we'll discuss all the things. We already discussed rather, but I just want the answer from you guys. Okay. So if we talk about the fourth one, which of the following cardiac condition does a fourth heart sound? Now over here, they're talking about heart sounds. Fourth heart sound, that is, we are talking about the S4. So when the heart sounds, what are the different types of heart sound that we should know first, right? So let's talk about that. Okay. So let's see what are the different types of heart sound. Okay, so heart sounds. Now remember, there are four different heart sounds. First is the S1. This S comes for sound. Okay, and this is a standardized one. Yes, I'm getting the answers. Bera, Akhil, Bhavika, Dishya, Aisha. Right. So you are giving the answer. So we'll go back. Okay. So we'll go back. So what is the answer? I guess there is a delay. So yes, there is an issue in that. But yeah, which one of the following landmarks is correct? Obtaining and apical pulse. You all are correct. The answer over here is option B. The question number 3. For that, the answer is option B. That is left fifth intercostal space, mid clavicular line. That is the area for mitral valve. We just now discussed that, right? So if you know the concept, whatever the question is, you can easily answer those questions, right? Right. Okay, Aisha gave the answer 3 times. Okay, yeah, you're correct, Aisha. You're very correct. Let's move on. Which of the following cardiac condition does the fourth heart sound? Okay, so can you answer this question? I'll be very happy if you answer this question, because we already discussed the heart sounds in the theory part, right? And if you do not know, let's go back to the discussion of the heart sounds, right? So S1, when the S1 is here. So I told you there are two AV valves, right? That is atrioventricular valves. Whenever these valves are going to close, so whenever you shut the doors, what is going to happen? There will be a presence of sound, right? So whenever we are closing these doors, that is the atrioventricular valve closure, So whenever we close this valve, right, then there will be a sound. Then there will be a sound. That sound will be your S1. That sound is nothing but your S1. Okay. So this S1 will come whenever there is a closure of AV valve. When the S2 is going to come, whenever there is closure of semilunar valves. Semilunar valve closure. Okay, so SL valve. We say in short form, we say SL valve closure. So how to remember? First, which alphabet is going to come? A, obviously. So that's how you can remember. The A comes first, right? So that's why the S1 will be coming whenever there is a closure of AV valve. Then, even if you do not remember this trick, the S2 is going to come. So S for second and S for, yes, please. When we write second heart sound, right? So S, over here also you will find the S, right? S for second and S for semilunar valve, right? S for second and S for semilunar valve closure. That is, the S2 is going to come whenever the semilunar valve is going to close. Okay, what about S3? S3, remember, there are two types of filling. Whenever the heart, suppose this is the atria, okay, and this is your ventricle. So whenever the blood will flow from the atria towards the ventricle, what is going to happen is that it will fill the ventricle in two different phases. There will be early phase and there will be late phase of filling. Okay, so there are two phases of ventricular filling. So I'll just write it down. Two phases of ventricular filling. First phase is the early phase and second phase is late phase. Okay, so there are two phases depending on which phase is going on in that area. So at that point we are going to hear a heart sound. So what is that? S3 will be here. We can heard that sound whenever the early ventricular filling is going on. Okay, early ventricular filling is going on, right? And this will be your 2/3 filling. This will be very, very rapid filling. We cannot hear these sounds normally, remember. Only this S1 and S2 will be heard physiologically. S3 is abnormal except in the pregnancy. So we can hear the S3 sound in the pregnancy, remember, but except in all other condition except pregnancy, we cannot hear the S3 sound. So this is not audible normally. Normally this is not audible except, yes please, except the pregnancy. Okay, so that means if you are hearing the S3 sound, either the female should be pregnant or it is abnormal. It is abnormal. Okay. And what we talk about S4, whenever we talk about S4, that means that is going to happen whenever the late filling of the heart is going to happen. In the phase of late filling of ventricles. Late filling of ventricles are going to happen. At that point, you are going to hear the S4 sound. Okay. What is the difference between early filling and late filling? What happens as soon as these valves were closed, right? There will be no blood flowing from the atria towards the ventricle. But as soon as these valves are open, the AV valve open, the blood start to flow from atria to ventricle, right? How? In the early phase, this filling occurs due to gravity, right? The atria are present above and the ventricles are present below. So that's why, because of the gravity, this early filling will occur. And what about the late filling? Remember, at the late filling, the atria contracts. So almost all the blood goes in the early filling. That means I told you that 2/3 filling will occur during the first phase and rest of the 1/3 filling will occur during the late phase in which the atria is contracting, right? So that's why in the late filling, the atria will be contracting. And as I told you, normally physiologically, remember, physiologically only S1 and S2 you can hear in a normal person. If you are hearing S3 or S4 and the patient is not pregnant, so these are abnormal. Abnormal if you are abnormal, if audible. If audible, then these must be abnormal. These must be abnormal. Physiologically only we can hear S1 and S2. So let's come back to our question, what it is saying us. It is telling us that S4 sound, if you're hearing, that means what should be the abnormality? Can you tell the answer on the basis of this now? Dilated aorta, we talked about aorta in any of the sound? No. So this cannot be the answer of this question, right? Normal functioning heart, I told you whenever the normal functioning of heart is going on, S3 and S4 are not audible. So that's why this option B cannot be the answer. Decrease myocardial contractility. We are not talking about myocardial contractility, right? We are only talking about the atrial contraction that happens during ventricular filling, right? So this cannot be the answer of this. Then failure of ventricle to eject all blood during the systole. That means if the blood is remaining, so that means if the blood is remaining, if the during the systole the blood is not going, that means if the blood is remaining in the ventricle and it is not going out during the systole, what is going to happen? The S4, that means the filling, the late filling will be affected. The late filling will be affected, and that's why, right, you cannot fill the bucket which is already full, right? So that's why the over flooding will occur, right? And that's why what you're going to hear is the S4 sound. You're going to, atria will push more and more. Why you're not going to hear the third heart sound? Because this is under the effect of gravity, right? Even if the gravity is acting, the ventricles will not be able to fill. So what the atria will do? Atria will push harder and harder. It is going to contract more and more, and that's why you're going to hear the S4 sound. Why? Because during the normal phases, this is not audible, but already the ventricles are filled. Because what happened in this case is that in this case, the ventricle did not eject all the blood, and that's why atria has to apply more and more force, and that's why the S4 will be heard very, very prominently, right? So answer over here is option D. Yes, the Aisha answer given correctly. Akhil, you are also correct. Now I hope everybody can understand this concept, right, and give the proper answers, right? Let's move on. Thickest layer of heart. So what are the layers of heart and what is the thickest layer of heart? I don't need to write anything down, right? Why? Because I do have a diagram for you guys, right? So let's see what is the layers of heart. So you can see in this diagram what are the layers of heart. So the first layer, if we talk about, this is the endocardium. Okay, then you can see the middle layer, which is orange color, that is myocardium. And you can see two yellow colors, the two yellow color layers of the heart, that is nothing but your pericardium, the yellow color ones and the blue color one. So these are the all three layers will be called as pericardium. Now what is the difference? These pericardium will be subdivided into different parts, right? What are those different parts? First is the visceral pericardium, that is also known as epicardium, that is also known as epicardium, right? And then the parietal pericardium. Whenever we talk about visceral and parietal layer, remember visceral, that means it is towards the organ. It will be inside one. Okay, so endocardium is the inside innermost layer. Then the myocardium, which is going to contain the muscles, and you can see the thickness of this myocardium layer. It is the most, or it is the maximum out of all the layers, right? And if we talk about the pericardium, it is divided into, first thing is fibrous pericardium and the inner pericardium, which is again divided into visceral pericardium and parietal pericardium. So if I have to write this down, how can I write this down? So see, there are different layers of this, right? What are the different layers of the heart? So different layers of the heart. So heart, there are three main layers. What are the three main layers? The innermost layer, the middle layer, and the outermost layer. Outer layer, let's write that. Outermost layer. So innermost is endocardium. It is a layer on the heart, and cardium means heart, endo means inside, right? So innermost layer, that is endocardium. The middle one, M for M, that is myocardium. That is nothing but myocardium. The outermost layer is known as pericardium. This is known as pericardium. Okay, this is known as pericardium. Now this pericardium is divided into, again, it is subdivided into three parts. That is visceral pericardium, that will be the innermost layer, visceral pericardium of the pericardium, right? Visceral pericardium, then parietal pericardium, and the fibrous pericardium, okay? So this is how this heart layers look like, right? First is endocardium, myocardium, and pericardium, which will be this pericardium will be, yes please, divided into sub three part. And this visceral, this question was asked already, that visceral pericardium is also known as, so remember, this visceral pericardium is also known as epicardium. Epicardium is not another layer. This visceral pericardium is also known as epicardium. The visceral pericardium is also known as epicardium. And the thickest layer is your myocardium. And that's what the examiners want you to know. Why? Because heart is like a pump, right? So you must have heard the Hindi songs, Mera Dil Ye, Mera Dil Wo. This is nothing but a blood pumping machine. This is nothing but a blood pumping machine. As a medico, if somebody asks you what is heart, so what you're going to say, it is just like a pump, right? So if it is a pump, what is its or the most important part of this pump? Pump is to throw or to push, right? To push, you need more and more muscle, right? So that's why the myocardium is the thickest layer of this heart. Myocardium is the thickest layer of the heart. So the answer over here, yes guys, the answer of question number 5 is myocardium, B, right? It is B. Pericardium we see, that is outermost part, right? Myocardium is middle one, endocardium inner one, and the part of the pericardium, the visceral pericardium, is known as epicardium. It is also known as epicardium, right? So answer of this question number 5 is option B, right? Option B. Yes, Himani, you're correct. Akhil, Aisha, okay. Now you understood? Aisha and Akhil, I hope now you understood the part of this. Okay, let's move on to the next. Chordae tendineae is found in. So this chordae tendineae, what do you mean by chordae tendineae? So remember, the chordae tendineae is nothing but, so I'll just write CNT. Chordae tendineae is nothing but, they are the fibrous structures present in the ventricles of heart. For what? Remember, you do have valves, right? What is their function? We do have valves, right? So the valves should be kept in place, right? So that whenever they need to open, they should open, and whenever they need to close, they should close, right? To have that proper function, we do have these different chordae, tendineae. So I hope you can see the diagram right now. So over here in the ventricles, the fibrous structures that you are seeing over here, these are nothing but your chorda tendineae. These are nothing but your chorda tendineae. Okay, so this in real life they look like this. Okay, these are the fibrous structure, so they are preventing the valves to go back into the atrium, right? The AV valve should open into the ventricle, right? And they should not go reverse into the atria, otherwise the blood can go in the another direction, right? So this is your chordae tendineae over here, and over here this is shown, right? So you can see the valve over here, you can see the valve over here, right? And this valve should not go in the reverse direction, and that's why this chordae tendineae keep the valve inside the place. Okay, so they are acting as a hinge, you can say, okay, so that the door will not open in the opposite manner, or it should not cross the line of the ventricle, right? So that is nothing but your chordae tendineae. So you can answer now. What should be the answer of this question? Yes, please, guys. What should be the answer of this question? So if I draw a valve like this, suppose this is the atria and this is over here your ventricle, right? I'll draw the valve in the red color. So if you see, this is the valve, okay? And this is opening and closing, but it should not go in the atria like this. If this happens and the heart contracts, the blood can go in the reverse direction. There must be some arrangement so that these will be kept in place. So what is the arrangement we do have? Yes, please. We do have the chorda tendineae. We do have the chorda tendineae, right? So that the backflow of the blood will be prevented. So these are the chorda tendineae which prevent the valve to go in atria, which will be abnormal, and that's how they prevent the backflow of the blood. They prevent the backflow of the blood, right? And that backflow of the blood is known as, yes please, anyone can tell me what is the fancy name for the backflow of the blood? This is known as regurgitation. This is known as regurgitation. If the backflow, sometimes what happens due to trauma or some injury or some infections, this you can say the chordae tendineae, they rupture. If the rupture this of the chordae tendineae occur, rupture due to any reason, rupture of chordae tendineae occurs, then the backflow cannot be prevented, and then the regurgitation, that means backflow of the blood which is abnormal from the ventricle into the atria, that will happen, right? Rather than going into the aorta and pulmonary artery, the blood will flow back into the atria if the chordae tendineae is not there. The chordae tendineae will rupture, and then only Akil, we do have regurgitation. Okay, then and then only we do have regurgitation. Okay, not in the vice versa. If chordae tendineae are proper and valves are working properly, right, then this backflow will not occur usually. Okay, either there is a problem in the valve, okay, or there is a problem in the chordae tendineae. Okay, fine. Let's move on to the next question, right? So answer over here. What is the answer, guys? Question number 6. The answer of this question, yes, the Aisha is correct. Where are other students? Himani, you can try. Akil, Yes, please. Discharya. So the answer over here should be option D, not B. Remember, the chordae tendineae is present in the ventricles of heart. They're not present in the ventricles of brain. So the question number 6, the answer is option. Yes, please. The answer is option D over here. The option D is the correct answer for question number 6. Let's move on to the next question. The two major opening in the left ventricles. The two major opening in the left ventricles are. We already discussed the two major openings. Now I want the answer from you guys. Please, please, please give the answer of question number 7. So what is the answer of question number 7, guys? Yes, please. Question number 7. You guys will give me the answer of question number 7. So we already discussed that, right? If I draw a simple version of heart, what they're asking over here is about the left ventricle. So let's draw the left ventricle only, right? If I draw the whole heart, this is the left atria, left ventricle, right? And I showed you two different opening. One will be here, one will be here, right? So the one opening will be here, so that to allow what thing, the blood from atria to ventricle, and one opening will be here, so that the blood should go where, in the different parts of the tissue, right? So these are the two openings. Can you give the answer of question number 7? Yes, please. What are those openings? So in the left ventricle, we do have aorta and we do have mitral valve. We do have mitral valve. And this mitral valve is nothing but, yes, please, we do have mitral valve, bicuspid valve, and aorta. So over here, the answer over here, this thing is should be, yes please, B. Okay, the answer should be, actually the answers are wrong over here, or the, you can say the format over here. The usually what we see, because if such question comes, remember the best answer over here should be mitral valve, which is, remember, it is bicuspid. It is bicuspid, but in the maximum population it is bicuspid, but in some people we do find that the cusp means, as I showed you in the previous diagram, if you have two cups, so I showed over here two cups, right? We do want 3D diagram for this, like this. Suppose these are the 3 cups of this and they will close, that is known as tricuspid, right? If you do have 2 cups, that is known as bicuspid valve. Okay, so see, in this you do have 2 cusps and you do have 3 cusps also, right? So if we do have 2 cusps for this, so that is known as these, this will be closing together, so these are known as tricuspid valve and bicuspid valve. But in some people we do have what valve present? In some people we do have tricuspid also. So answer of the question number 7 is B. Okay, yes, Aisha, Akhil, correct, it is B. Okay, pulmonary vein cannot be present in the left ventricle. Remember, it should be aorta. Both cannot be present in the left ventricle. So the most appropriate answer over here is option B. Most appropriate answer is option B. Let's move on to the next question. Question number 8. Correct sequence of propagation of AP. This is very, very easy question, right? We already know that how the heart is going to follow the AP. So what is going to happen? So if I have to show you in this diagram, let's show in the this diagram only, that if I have to show you the action potential, so over here you'll have one node, over here you'll have one node, and then something will be followed like this, these fibers, right? So this is the phenomena which is going on in the heart. So this is known as SA node. This is known as AV node, atrioventricular. This sinoatrium. Why? Because this is present in the atrium. So that's why this node is known as sinoatrial node, right? This AV node, because this is present almost near to the junction of atria and the ventricle over here, and that's why it is known as atrioventricular node, right? Then the AP, that is action potential, is going to go follow. Over here there will be bundle of the fibers, that is known as bundle of His. Bundle of His. This bundle of His will be followed by two different fibers, that is bundle branches. They are said as bundle branches, and finally these fiber will divide and provide the, you can say, conduction to all the fibers, and these fibers, different fibers or the sub fibers, you can say, they are known as what thing? They are known as the Purkinje fibers. They are known as Purkinje fibers. Everything we discussed in the theory question already. So this is how the AP is going to get conducted from the SA node to AV node, right? From the SA node to AV node, from the AV node to the bundle of His, bundle branches, which we do have two bundle branches, left and right, right? And then it is going to go towards the Purkinje fibers to all myocardium. So that's why now you can tell me the answer over here. The bundle branches are not shown. So the answer must be yes. As Akhil said correctly, the answer is SA node. The answer is SA node, right? Then it is going to go to AV node, then bundle of His and Purkinje fibers, right? So answer is option A. Answer is option A. Let's move on to the next question. Which one of the following is known as waiting chamber of the heart? So which one of the following is waiting chamber of the heart? Usually both the atria are known as, usually what they say, both the atria or atria is the plural form for the atrium. That means left and right, or right and left. Both the atria are known as waiting chamber for their respected ventricle or respective ventricle. That is right ventricle and left ventricle, right? Right ventricle and left ventricle. So right atrium will be called as, yes please, the waiting chamber of right ventricle, right? And left atria will be called as waiting chamber for left atrium. Why it is known as waiting chamber? It looks as if the blood is waiting in the atria to go in the ventricle, right? But if they ask specifically the waiting chamber of the heart, then you must say that it is nothing but right atrium. Why right atrium? Because remember, the blood is continuously coming from the IVC, that is inferior vena cava and superior vena cava, towards the right atrium, and then from the various body parts. So from the body, the blood is coming into the IVC and SVC, right? Or we should write S above, because superior should be above, right? So SVC and IVC to go in the right atrium, and there is no valve present in between, remember. So that's why the blood, whatever coming from the body, it is going in the right atrium, right? And then it enters into the heart, right? From the whole body, right? the blood will enter into the heart via the right atrium. At this point, it will be waiting for how many seconds? So if you know the atrial systole and atrial diastole, atrial systole and atrial diastole, it is only for 0.1 and 0.7 seconds. So that means the atria will be contracting for how much time? For only for 0.1 second, right? So and the atria will be relaxing for how much time? The atria will be relaxing. Diastole means the atria must be relaxing for 0.7 second, and this point, during this 0.7 second, what is happening? The blood is coming towards the right atrium, right? Simultaneously it is also coming to the left atrium, but it is coming after the blood has gone from the right atrium to the right ventricle, then into the lung, and then into the left atrium, right? So that's why if we talk about the waiting chamber of the heart, that means the blood is waiting for 0.7 seconds to go into the ventricle, that is from the body. First of all, the entry of the blood happens into the heart in which section? It is the right atrium. So answer over here of this question is, yes please, right Akhil, it should be option C. It should be option C, right? It should be option C. Let's move on. What is the first innovation for a client experiencing myocardial infarction? So, suppose you are doing some dental surgery or dental extraction or any other surgery, and suddenly the patient feel chest pain, and you have a doubt that the patient is landing up into the myocardial infarction. So what you're going to administer the first step, what will you give? So all the things should be done in the myocardial infarction. You should give him the morphine, you should give him the oxygen, then sublingual nitroglycerin, and also you should confirm it via doing ECG, that is electrocardiogram. But can you answer me that when this you are going to do the first, when all these things should be given at a stepwise manner? Yes Akhil, I'll discuss this after this question, and then we'll wrap up the session, right? But first of all, answer me this question that first of all, what you're going to do. Always and always remember, you are not going to do the electrocardiogram, because even if the patient is having MI or not having MI, the ECG will at least if everything is available, the ECG will take time like 15 minutes or 20 minutes, right? During that time, more and more injury to the heart is going to happen, and that's why what is going to happen is that first thing, whenever the MI happen, your standard book says that you have to give the oxygen, right? Myocardial infarction means that the myocardial cells are dying. Myocardial cells are dying. So if you have to take a quick action, how you can prevent the injury? This prevention of injury can be done via how this can be done if you give the oxygen, okay? So what you can give, first of all, give him the oxygen, so that to prevent further injury. You cannot prevent the MI directly, but if you give the oxygen, the further injury will be prevented. The further injury is prevented, right? So that is the condition you need to have over there, right? So first thing, if they ask you what is the first thing that you're going to give, is the first thing that you're going to give is the, yes please, the oxygen. The first thing that you're going to give is the oxygen.